Have you ever walked into an hospital and felt like no one is talking to each other? One nurse comes in and asks for your name, and other one comes in and asks for your medication you are on. And then when you visit the doctor comes in and asks for the same questions again. And your specialist, they have not yet even seen your notes again. Behind the scene, there's a silent problem, which is reckoning the patient outcomes. That's called care coordination. If you're a founder and trying to fix healthcare, this might be your wedge. At its core, care coordination is about making sure everyone involved in the patient's care is on the same page: the doctors, the nurse, the specialists, and even the admin team. Sounds simple, but it's a real mess. In reality, nobody is on the same page. In most cases, they're not in the same system, not even in the same building. One hospital we looked at used 14 different platforms just to manage a single surgical admission. You think those tools talk to each other? I think not. They don't. So everyone's chasing charts, paging each other, and documenting the same thing in three different places. 1 in 3 malpractice cases traces back to communication breakdown. Not a misdiagnosis, not poor treatment, just teams not talking. This isn't just an operational problem. It's a liability problem, it's a revenue problem, and it's a trust problem as well. Delayed discharges, missed test results, patients falling through the cracks because nobody knows whose job it is to follow up. Founders always ask, don't hospitals already have software for this? Yes, it's called EHR, and it's basically glorified filing cabinet. Most EHRs weren't designed for real-time coordination. They store data, but they don't orchestrate the work. So people bolt on Slack, WhatsApp, or spreadsheets, whichever works for them, until it doesn't. You need to assign tasks, share handoffs, message across roles. Instead, it's email chains and sticky notes. When founders think about care coordination, they straightforward jump into messaging. Let's add chat, let's connect the data. But the real gaps show up in the day-to-day execution of the care. Let me walk you through 3 points in the workflow where things quietly fall apart. First is task ownership. In most hospitals, there is no single source of truth to know who is responsible for what. Then there's visibility problems. Not everyone needs full access to information. A case manager does not need full clinical notes. A nurse does not need to know the billing codes. But most tools either show too much or just not enough. And finally, handoffs. This is where things fall apart fast. The day shift leaves, the night shift logs in, and without structure in transitions, half of the open tasks fall apart. It's fair to ask, with all the money spent on systems like Epic, Cerner, or MedTech, aren't they solving care coordination already? Epic is most widely used EHR in US. It has care team messaging and task features, but they are usually buried behind the extra licenses, workflows, or interfaces teams aren't trained to use. Cerner, now owned by Oracle, offers coordination features too. But unless you are on their Millennium platform and have trained every unit to use it, you are still stuck with fragmented handoffs. Meditech, often used in community or regional hospitals, does have coordination dashboards, but they depend heavily on manual updates and user disciplines. These are massive platforms optimized for documentation and compliance, not real-time cross-role coordination. And because most hospitals can't fully customize or operationalize these features, teams default to workarounds. And that's where things fall apart. The opportunity here is to build care collaboration layer on top, the one that turns scattered data into coordinated action. We have seen traction with tools that deliver real-time task visibility, role-based alerts, shift handoff workflows baked into the UI. These aren't the bells and whistles. They are what make the difference between reactive care and coordinated care. Coordination failures in healthcare aren't people problem. They are systems problem. If you are building in this space, think beyond chats and messages. Build for how teams actually work together.